There are many ways to view addiction. One model views it as the best available answer to the challenges of life given one's current resources. Through this perspective, addicts aren't broken. They've merely learned the wrong answers to life's questions. The solution? Provide healthier and motivating solutions to replace addictive behaviors.
I view addiction as chronic, ongoing, progressive, and deadly until treated. And at Ohio Community Health, we've created a patient-centered model to be able to tackle all aspects of not only addiction, but also co-occurring mental health disorders, because you're going to be hard-pressed to struggle in addiction and not feel depression, anxiety, put yourself in traumatic situations. So we use evidence-based treatment in a variety of different levels of care to ensure that we are treating the entirety of that individual and any struggles that they might be dealing with.
The actual substance use itself is just the expression of the problem. Another way that the model here differs is those thoughts and feelings that cause the individual to feel the need to put substances in their body. Those are also the thoughts and feelings that disconnect them from the people in their life. So our focus here is really identifying what is the root cause of the addiction, and then how do we start to change these thoughts and feelings to start to foster some more positive relationships.
So I've worked with the Hamilton County Probation Department and our courts here in Cincinnati, Ohio for close to 25 years. There's been significant changes in the philosophy and the trends in the criminal justice system over those 25 years. Criminal courts, by design, their purpose is to address specific behaviors or actions with the idea to hold those individuals accountable, to be able to restore some level of justice to the victims and the community as a whole. But the reality is, if we only address the act or behavior, we're really only addressing the symptom and not getting to the root cause or the underlying problem and need areas, such as addiction, mental health. When we're working with those individuals to try to solve those underlying problem need areas, we tend to see significantly more success. Ohio Community Health has been a phenomenal partner with the Hamilton County Courts, providing specifically addiction services. But what makes them unique and why they've been just a phenomenal partner is they treat the individual with dignity and respect. They view the person from a holistic standpoint, and they don't just address the addiction, but they actually address the mental health as well. We've seen a lot of success with people moving forward and breaking that cycle of recidivism.
Many recovery centers cater to wealthy patients who either pay in full or through commercial insurance. The Medicaid population is typically underserved, yet still in need of this specialized care.
For so long, Medicaid treatment centers specifically have kind of fallen into the trap of treating individuals like with a one-size-fits-all approach. And we have come to learn that that definitely does not work. Clients will be put on the same medications, they'll be given the same treatment plans and stay in treatment for the same length of time. And that's really something that we wanted to avoid when we founded Ohio Community Health.
When individuals are treated for other issues, they never feel the need to ask their provider, like, have you ever broke your arm? But when it comes to alcoholism and addiction, the clients that's one of the first questions they ask. And I do think that personal experience that our staff has in recovery and suffering from the disease of addiction, it helps them to build that rapport with the clients and trust.
The benefit of having staff who is in recovery, I think it's everything at Ohio Community Health, because the connection that we are able to make or they are able to make with the clients is that much stronger because they've been in the position before. It gives them a unique perspective on what the clients are going through.
No matter your situation, addiction recovery is within reach. Located in Cincinnati, Ohio Community Health Recovery Centers serves the Medicaid population with its holistic, evidence-based recovery program.
The founding of Ohio Community Health, in my mind, was born out of necessity, because I am a recovering addict alcoholic and I went through a private facility. I've been working in this field for 10 years on a private basis. Can we still deliver that same quality of care that I used to be delivering on a private basis, but offer it to the community? And the short answer to that question was yes. So Ohio Community Health was born.
I've been to treatment 13 times, and you kind of feel like you're in prison. Nobody wants to be in treatment, but at the time, they made it the best that it could possibly be. I felt like I was a person. I didn't feel like I was in prison. I had independence that I needed, but just enough control that it kept me safe from going back out and doing what I was doing before. It's pretty amazing. I have a pretty wild story. I'm actually a doctor, and through addiction, I lost everything. My house, failed marriage. Everything. In my recovery after 2 years, I have everything back. I got my job, my kids, house, business, everything that I lost, I have back. And I didn't think that was gonna happen.
The only way to achieve sobriety is through support, and treatment providers like Ohio Community Health Recovery Centers are there to answer the call. It is possible to live a life without drugs.
I was doing detox in a local hospital, and I'd been everywhere in town. I had no idea what I was gonna do next, and somehow somebody reached out to me from Ohio Community Health and told me about their new program that they had. I'd never heard of it before. It was the place that actually allowed me to get sobriety for the first time.
Currently, we have the capacity to treat about 50 patients at a time. We're shortly growing to a second facility here on the east side of Cincinnati. My goal and my plan for Ohio Community Health is just to allow us to be able to help more people. That's why we're here.
For more information, visit ohiorecoverycenters.com.